from stories around the world to stories here at home. This is the National News Broadcast. A pleasant evening. I'm Dalanjali Ananda.
Good evening indeed. I'm Charita Vinupurarachi, and now let's move on to the headlines for tonight's news.
A total of 11,031 COVID-19 recoveries recorded in the country. Minister Pavitra says the Minavankada COVID cluster has been neutralized. An active program under 10 divisions for the prevention of COVID-19. Another 7 arrested for violating travel restrictions. The program to facilitate reliefs continues amid challenges. A statement from State Minister Cabral. US Election Committee says the allegations on the alleged US election corruptions are baseless.
For those and other stories in detail on your top story. 7 suspects have been taken into custody during special area reconnaissance operations carried out in isolated areas using drones and helicopters. A total of 22 have been taken into custody within a period of 2 days. Special area reconnaissance operations were carried out in isolated areas in Western Province today. Accordingly, police media spokesman DIG Ajit Rohana said that the violators of travel restrictions were taken into custody during these operations. The operations are a joint venture initiated by Sri Lanka Air Force and Sri Lanka Police.
Yesterday, we initiated an operation along with Sri Lanka Air Force in order to conduct surveillance upon the inmates of lockdown areas, and we used helicopters and drone cameras in order to get the movements of the inmates of lockdown and isolated areas, and accordingly we arrested 15 suspects who have violated the quarantine rules and regulations, especially the restriction order made by the Director General of Health Services. And today again we conducted the same operation with the Sri Lanka Air Force, and we conducted surveillance in the areas of Modara, Mount Lavinia and Horana, and we arrested 7 suspects in the operation. And accordingly, total number of 22 suspects have been arrested in this connection. And we are hoping to conduct constant operations, air operations and drone operations in order to make surveillance in respect of the inmates of lockdown and isolated areas.
Police media spokesman DIG Ajit Rohana also briefed on the present COVID-19 situation related to the Sri Lanka Police.
In addition to that, there is a misconception among the general public that whole police organization is having COVID positive patient. That is absolutely wrong. So our total strength is 90,000, and 80,000 officers are on duty at the moment, and they have not been affected. However, 3,000 police officers have been sent to quarantine centers, and regularly COVID positive patients are found from that quarantine centers, and the disease has not been spread to the whole police community. And it is a misconception among the general public. So it is absolutely false and bogus. However, we have taken considerable measures in order to control the spreading of COVID-19 among the police community, and it has already been controlled. And the first, second, and third contacts of the COVID positive police officers have been isolated, and they have been sent to quarantine centers.
Those who are suffering from chronic diseases among the residents of the isolated multi-storied housing complexes in Colombo Municipal Council limits have the tendency of escalated complications related to their illnesses due to the COVID-19. Therefore, the Ministry of Health has instructed to be more cautious in this regard. A methodology to continuously supply medicinal drugs for such patients has been initiated. Accordingly, the name of the patient along with the age, residential address and the address of the hospital or the medical centers should be provided to the police officer in charge of the multi-storied housing complex or the relevant manager of the Urban Development Authority. Director General of Health Services Dr. Asela Gunawardena said that steps will be taken to deliver the medicines to the doorsteps through this methodology. The Railways Department has informed that all passenger train services have been cancelled on Saturday and Sunday, which are government holidays. The department further indicated that all office and provincial railway services will resume as usual from Monday onwards. Welcome back. Meanwhile, Chief Epidemiologist Dr. Sudat Samaravira a request to Hindu devotees across the country to adhere with the guidelines issued on the conducting of Rupavahini festival in an effort to curb the spread of the COVID-19 outbreak. He made these remarks during a media briefing held today.
The Deepavali festival will be held in commemorating by Tamil community, especially the Hindu community tomorrow. This is one of the most important festival for these people. But we know that with the current situation in the country, it is not a good thing to celebrate it and gather the people in hovels or temples, meeting other people or get together. So similar that how that we celebrate the Sinhala and Tamil New Year in this year, that we have to celebrate Deepavali also in the same manner. We request all the people to stay at home, celebrate it at their own residences, not to come out, not to visit other people's homes or not to visit COVIDs at this time. Do all the religious activities and also other festival activities on their home.
And here's the world update of the COVID-19 pandemic. The United States set a new record of daily coronavirus infections with over 144,000 cases last night, breaking the total confirmed cases over 10.52 million. Meanwhile, Britain hit a new daily high of 33,470 confirmed coronavirus cases yesterday. The US and Europe continue to lead the world in new infections, as the US confirmed a world record of 143,231 coronavirus cases in 24 hours. The total number of COVID-19 cases in the country rose to 10.526 million, with 242,600 deaths. The average daily increase of coronavirus infections has exceeded 127,000 over the past 7 days, around 35% higher than the previous week. The new deaths resulted from the disease reached 1,893 on a daily basis, on the highest since the beginning of May. By far, the United States remains the nation's first hit by the pandemic, with the world's most cases and deaths making up about 20% of the global caseload and death toll respectively. Meantime, US state of California crossed a grim milestone in its battle against the coronavirus, as the state became the second in the US to surpass 1 billion cases of COVID-19 yesterday. The United Kingdom has posted its biggest one-day jump in confirmed coronavirus infections, with the government reporting 33,470 new cases. The figure reported yesterday was 10,520 more than the number of positive cases reported a day earlier, and pushed the total number of case load in the UK since the pandemic began to almost 1.3 million. More than 50,000 people have died from COVID-19 in Britain, Europe's deadliest death toll. The surge of new coronavirus cases appears to be slowing in Germany and France, generating hopes that two European nations are bringing regional control over the pandemic. 2 weeks into its second nationwide lockdown, France has recorded 33,172 cases yesterday, taking the country's cumulative number of confirmed cases to 1.89 billion since the outbreak of the pandemic. Germany reported 23,542 new cases of coronavirus infections and 218 deaths today, the highest single-day increase since the beginning of the pandemic. Despite a partial lockdown imposed on November 2nd, the 7-day average of new infections remained above 18,500. Germany has the fifth highest tally of coronavirus infections in Europe, behind France, Spain, the UK and Italy. The national total now stands at 751,000 cases, with at least 12,200 deaths. A new surge of coronavirus cases in Japan is falling hospitals' bed at close to critical levels, putting pressure on government to take action to curb the new infections and relieve strains on the healthcare system. Japan set a record with 1,684 new cases today, touching a second straight daily high. Health officials have raised alarms that the country is heading into a third wave of the COVID-19 pandemic.
Now, the Secretary-General of the United Nations, Antonio Guterres, says that the COVID-19 pandemic has made people face one of the worst recessions in modern times and has had a devastating effect on the most vulnerable countries and peoples. He made these remarks during the 44th annual meeting of Ministers for Foreign Affairs of the Group of 77, also known as G77, yesterday. The G77 was established in 1964 by 77 developing countries. The group, with its current membership of 134 nations, provides the means for the countries of the Southern Hemisphere to articulate and promote their collective economic interests and enhance their joint negotiating capacity to all major international economic issues within the United Nations system and promote South-South cooperation for development. UN Secretary-General Guterres expressed his concerns over the effect of COVID-19 pandemic to vulnerable countries and peoples during the meeting.
The pandemic has pushed us towards one of the worst recessions in modern times, which is having a devastating effect on the most vulnerable countries and peoples. The progress we have made together over recent decades on your top priorities, eradicating poverty and hunger, increasing opportunities for all, and reducing inequalities within and between countries, that progress is being eroded in a matter of months.
UN Secretary-General Guterres also commented on the world's multilateralism and cooperation this year, and he has been looking forward to observe the changes in these aspects next year.
This has not been a good year for multilateralism and international cooperation. So far, the world has not seen the unity and solidarity needed to tackle the pandemic, beat the climate crisis, and the awakening of nuclear safeguards and strengthen cooperation around digital technology. I hope 2020 will be the year in which we reverse these trends, and the year we are able to forge a global alliance for carbon neutrality.
And here's the local update of the COVID-19 pandemic. Ministry of Health says that a total of 11,031 COVID-19 recoveries were recorded in the country at present. Meanwhile, 378 COVID-19 recoveries were reported in the country today. Another 30 COVID-19 patients directed to the Pinnavalla COVID Treatment Centre have left the centre following their complete recovery. They have been identified as residents of Colombo, Gampaha and Kaluthar areas. A total of 6,632 COVID-19 recoveries were reported in the country since the beginning of this month. The highest number of recoveries were reported on November 5th. Another 378 recoveries were recorded today. A total of 11,031 COVID-19 recoveries has been reported from the country at present. A total of 373 COVID-19 patients were detected from the country yesterday. Meanwhile, 470 COVID-19 recoveries were reported in the country yesterday. A total of 198 COVID-19 patients were detected from the country today. The patients have been identified as close contacts of the Palyagude COVID-19 cluster. Meanwhile, 378 COVID-19 recoveries were reported today. A total of 10,111 PCR tests were conducted yesterday. Accordingly, 637,122 PCR tests have been conducted in the country at present. Meanwhile, Epidemiology Unit has indicated that the process to conduct PCR tests in all prisons and to identify COVID-19 patients is currently underway. The Select Committee on Parliamentary Business has decided not to convene the members of Parliament currently detained in the Valikada and Magazine prisons and parliamentary sessions. Accordingly, Sergeant-at-Arms of the Parliament Narendra Fernando said that the MPs Sivanesh Durai Chandrakanthan, Rishad Baduddin and Premaral Jayasekara will not be convened to the Parliament meetings. However, he said that those parliamentarians will be convened to the Parliament with health protective guidelines during a voting at the Parliament. Meanwhile, 12 inmates of the Colombo remand prison have been tested positive for COVID-19. Accordingly, a total of 172 COVID-19 patients have been reported from prisons.
We have observed that the COVID-19 cases are identified in prisons in our country, that when the people are living in a congregate setting, very limited space, overcrowding, that disease can spread very rapidly, that we have identified this in Velisari Navy camp as well as Kandakadu camp as well as in the Minuangoda factory. So the similar thing can happen here. So because of that, what we are doing now is identifying the patients and they are removing to them secured separate place, and also that we are continuing doing the PCR testing among these inmates as well as among the staff of the prisons, and to identify these cases as early as possible. So with the isolation of these cases from the other people in the prisons, that we hope that we will be able to rapidly control the disease spreading of the COVID-19 in prisons.
The complete active intensive care unit of the Homagama Base Hospital, donated by Dialogue Yata Company, was vested with the public recently. It was held with the presence of Ministers Pavitravahini Arachi and Bandula Gunawardena. The 10-bed intensive care unit was constructed in accordance to a request of the Ministry of Health. The intensive care unit is equipped with necessary technological facilities to maintain as a low-pressure condition zone to efficiently carry out treatments for communicable diseases such as coronavirus. Meanwhile, the Ministry of Health said that the decision over the burial of the deceased with COVID-19 will be taken in accordance to the final report of the expert committee appointed in this regard. The Director General of Health Services confirmed 5 COVID-19 related deaths in the country today. Accordingly, the COVID-19 death tally in the country increased to 53. One of the deceased has been identified as an 83-year-old female from Colombo 14, and the cause of her death has been determined as COVID-19 infection along with a chronic diabetes condition and high blood pressure. Another deceased has been identified as a 68-year-old male from Chilo, has been transferred from Chilo District Hospital to Mulderya Base Hospital for treatment. The origin of his death has been determined as brain hemorrhage due to high blood pressure triggered by COVID-19 infection. A 69-year-old male from Ratmalana has died from a chest pain following admission to hospital. The cause of his death has been determined as COVID-19 infection along with a chronic diabetes condition and high blood pressure. Another deceased has been identified as a 78-year-old male from Colombo 13, and the cause of his death has been determined as COVID-19 infection and cardiac arrest. A 64-year-old male from Colombo 13 has been identified as the 5th COVID-19 death in the country. The cause of his death has been determined as COVID-19 related pneumonia condition and COVID-19 infection. And meanwhile, the distribution of 5,000 rupee allowance for the public affected from the restrictions imposed on the movement in the face of COVID-19 outbreak is continuing further. The government has taken steps to provide a food package worth 10,000 rupees for each family undergoing quarantine process. Meanwhile, Vimal Veeravansha has said that 50,000 affected families in Colombo district have received the 5,000 rupee allowance. The minister made these remarks while taking part in the event to distribute 5,000 rupee allowance for the affected residents in several Gramaladahari divisions in Malabe, Kaduvela. Parliamentarian Pradeep Unuguda was also present at this occasion. Meanwhile, 1,200 families in Makumburi North Gramaladahari division in Kottava also received 5,000 rupee allowance. Also, 14,939 residents and 467 families in Todamguda area in Kaludra received the 5,000 rupee allowance and the 10,000 rupee worth food package respectively. 394 families in Horape Gramadildahari division in Ragama received the 5,000 rupee allowance yesterday. Meanwhile, food rations were distributed for the families which are undergoing quarantine process at present. In addition, 447 quarantining families in Illupugedro Gramadildahari division in Kurunagala also received the 10,000 rupee food package yesterday. 90% of the people in Vallavatta and Kollupiti areas have received the 5,000 rupee allowance.
Minister Rupavahini says that initiatives have been undertaken through 10 divisions of the Ministry of Health for the prevention of COVID-19 outbreak. She said that the success of these initiatives can be exemplified with 0 COVID-19 patients reporting from the Minuwanguda COVID-19 cluster. The minister made these remarks while taking part in the concluding address of Parliament adjournment debate over the rapid antigen testing kits. The proposal for the adjournment was tabled by the opposition. Minister Rupavahini said that as the government, the prevention process of COVID-19 outbreak in the country has been carried out under 10 divisions. She said that only several countries, including Sri Lanka, in the world have been able to carry out the contact tracing process in a swift manner. She said that 0 COVID-19 patients have reported from the Minuwanguda COVID-19 cluster at present. The minister also said that the World Health Organization has commended the country over current resistance, case investigations, surveillance and rapid response. She further said that the government would not allow the country to collapse. The minister said that with the head of the Presidential Task Force, Basil Rajapaksa, President Gotabaya Rajapaksa has decided to distribute 5,000 rupees allowance for the affected public in curfew-imposed areas and to provide a food package worth 10,000 rupees for each family undergoing quarantine process. Sri Lanka Ex-Servicemen's Association pinned the poppy flower on Prime Minister Mahinda Rajapaksa. The poppy was pinned in parallel to the World Poppy Day celebrations. The event was held at the Prime Minister's official residence in Vijayarama Road, Colombo this morning. The World Poppy Day is observed on November 11th. The Remembrance Day has been observed since the end of the First World War to remember armed force members who have died in the line of duty. This year's remembrance ceremony is set to be held near the War Memorial in the Vihara Mahadevi Park on the 15th. The funds earned from the sale of the poppy flowers will be utilized for the welfare of war veterans. The attention was directed to obtain the assistance of the housing project expected to be constructed in Polonnaruwa for the housing facilities deprived retired officers over the age of 60 years of the Sri Lanka Ex-Servicemen's Association. The association directed the attention of the Prime Minister over the removal of the custom levy on the poppy flowers provided to the country by the British Royal Commonwealth Ex-Servicemen's League and the initiation of a World Heroes Welfare Rotary. Prime Minister Mahinda Rajapaksa said that necessary measures will be taken on the request of the association. Accordingly, the Prime Minister instructed the Secretary to the Treasury over the removal of the custom levy during the meeting. President of the Sri Lanka Ex-Servicemen's Association, Major General Upul Pereira, was present at this meeting.
And meanwhile, parliamentarian Richard Badurdin has been further remanded till November 25th. The Colombo Fort Magistrate Priyantha Liyanage issued the order today following the rejection of the bail application submitted by the parliamentarian to the courts. The attorneys at law representing the parliamentarian submitted a request to the court to release him on bail, citing the possibility for him to contract the COVID-19 in the prison premises. However, prison superintendent informed the courts on November 9 while submitting a report that no prison officer or inmates has contracted the virus during the period when the parliamentarian Richard Badurdin was detained at the Magazine prison. Accordingly, the magistrate rejected the bail application, citing that there was no possibility for the parliamentarian to be exposed to the virus in accordance to the report submitted by the courts. Meanwhile, the third suspect of the case, accountant Alagaratnam Manoranjan, was also further remanded till November 24th. The Colombo Fort Magistrate granted bail applications for second suspect of the case, the project director Shamsuddin Mohammed Yazin.
The Social Infrastructure Facilities Development Committee of the National Programme to Uplift Rural Economy was convened at the Badula District Secretariat today. Discussions were held on the implementation of the proposed social infrastructure facilities development projects in the district. The program to uplift rural economy was initiated in accordance to a concept of Minister Nama Rajapaksa while implementing the Vision of Prosperity policy statement. The program has been initiated as a joint venture of all cabinet and state ministers under the guidance of Prime Minister's Office and Presidential Task Force on Poverty Eradication. A lengthy discussion was held on the severe shortage of the teachers in Badula district. A solution Ministry of Education has presented 5 proposals in this regard. The proposals consist of recruitment of graduates and GCE advanced level qualified persons. Another discussion was held on the establishment of a fund to develop the Winston Dyer Stadium and utilize the ground for football and to acquire necessary sporting equipment for the sportsmen in the district. The attention was directed on providing technological education for the youth, while discussions were held on the Piriven and Dhamma school education as well. Ministers and state ministers were present at this occasion.
And meanwhile, steps have been taken by the public representatives to improve and uplift public facilities and initiate other development projects in the face of the COVID-19 outbreak in the country. Operational Centre has been initiated with the objective of to expedite the activities related to the port. Minister Rohit Gunawardena has requested the employees of the port to extend their services even amidst the pandemic situation in the country. The government have directed attention to initiate a hardware market network titled Quiz Shop with the aim to supply quality and high standard commodities for the consumers at convenient price rates. Minister of Trade Bandra Gunawardena briefed in this regard during a media conference held yesterday. The printing of driver's license has been assigned to Sri Lanka Army from next year. The printing of license was carried out by a private sector thus far. The process to distribute driver's license was monitored by Minister Gamini Lokuge at State Minister Dilu Mamunugama. Pilot project of the home gardening program, jointly initiated with the participation of the students along with the mediation of the Ministry of Education, was commenced from the Mathugama Educational Zone recently. It was held with the participation of State Minister Pial Nishanta. A special secretariat has been established for the coordination of the foreign and projects related to Ministry of Agriculture respective state ministries. The secretariat was commenced with the presence of Minister Mahindananda Ludgamage.
The budget for the upcoming year of the United National Party governed Chilau Urban Council has been defeated. The vote for the budget was conducted this morning. 6 votes were received in favour of the budget while 13 votes were against. Councillors of the Sri Lanka Podujana Peramuna and Sri Lanka Freedom Party voted against the budget. Accordingly, the budget for the year 2021 of the Chilau Urban Council was defeated with a majority of 7 votes.
And meanwhile, it was revealed at Presidential Commission that Hara Foundation belonging to former Governor of Eastern Province MLA's Hizbullah has not been legally registered as a non-governmental organization in the country. An official at the Social Service Department made these revelations while recording a statement with the Presidential Commission of Inquiry on East Sunday terror attack. Former Governor of Eastern Province MLA's Hizbullah was present at the hearing today. The proceedings of the Presidential Commission of Inquiry on East Sunday terror attack, which was suspended temporarily on October 27th, considering the spread of the COVID-19 outbreak in the country, were resumed today while adhering to health protective guidelines. The hearing of the controversial Hira Foundation, which is considered as a social service organization, which convened at the Presidential Commission of Inquiry on East Sunday terror attack, former Governor of Eastern Province MLA's Hizbullah was present at the hearing today. Recording his statement, Social Service Officer of Department of Social Service, Dhammika Vasula Bandara, said that file belonging to the department indicated that the Hira Foundation was registered on September 9th of 1993. However, he said that he had observed a disciplinary in the party registration number of Hira Foundation along with the registration number of several other social service organizations during this period, and he further said that he also observed a disparity in the address mentioned in the certificate of the Hira Foundation and the address mentioned in the Social Service Department file.
Now, Minister Ajit Nivad Kabra says the government had taken steps to streamline the loan sector of the country. He made these comments addressing a press conference today.
As to how we would deal with the budget deficit would be announced on the 17th of November when the budget is presented. But I can also tell you that we are in control of the situation because we have made plans for all these eventualities. We know it's going to be a tough year, but at the same time it's going to be a year where if you plan carefully and then you make sure that your overall basis in which you are going to settle your debts is effective, we can make ends meet. You see, one of the key criteria on which Sri Lanka's debt burden ballooned in the last 5 years was one, because the rupee depreciated unduly. As a result of the rupee depreciation alone, we had as much as 1,772 billion rupees being added on to our debt. 1,772 billion rupees was added to our debt of about 13 trillion rupees, only because the rupee depreciated by these amazing numbers in the last 5 years. The second was because of the interest rates hike. The interest rates were unduly allowed to increase, and as a result, the overall interest burden that the country had to bear was also increased by as much as 1,430 billion rupees. Now, these are all numbers that I have taken from the central bank numbers, and you could see that these have occurred as a result of this kind of situation. Now, we are immediately controlling these aspects very carefully. The macro fundamentals are very important for us to manage carefully, because if you do that, you will find that our debt burden becomes a lot more manageable. Debt is not just to be settled as by taxing people as much as possible. Now, that was the move that the previous government made, which in my view was not the right way to go about it. They said we must increase the debt to GDP, we must increase the tax to GDP ratio, and went towards that number with a great deal of enthusiasm, forgetting that the other numbers can suffer as a result of that. Now, if they had managed it in a holistic manner, in a more balanced manner, they would have realized that all these macro fundamentals need to be balanced carefully.
The Sri Lanka Army contingent bound for United Nations peacekeeping mission in South Sudan presented a ceremonial salute to Sri Lankan Army Commander Lieutenant General Shavendra Silva at the Sri Lanka Army Medical Corps Regimental Headquarters ground in Verahara this morning. The Sri Lanka Army contingent consists of 66 members, including a medical team with 2 specialist doctors. In addition, personnel representing Sri Lanka Signal Corps, Corps of Engineer Service and the Sri Lanka Army Service Corps also included in the contingent. The 7th contingent of the Sri Lanka Army will be stationed at Level 2 hospitals in South Sudan.
And with that, we conclude Tonight News. Do it just tomorrow at the very same time. Stay safe. Good night.